We are live on DSTV, channel 421, Go TV 144. I'm Ernest Mino. Welcome to Joy News Prime. Ghanaians' health officials on high alert to prevent the spread of monkeypox as 5 cases of the rare infection has been confirmed in 3 regions across the country.
We have recorded 5 cases. They are all well, nobody is critically ill, and that we continue our surveillance to ensure that all cases that are identified and isolated.
But is it time to worry as Ghana faces triple threats from rising COVID-19 infections, influenza and monkeypox? We'll speak to public health experts. Also here on Joy News Prime, Ghana's inflation rate continues to rise, hitting an all-time high of 27.6%. Transport, food and utilities are the major drivers. Tonight, we ask, is there a way out? We'll be speaking to an economist for more on this, and later in the package, we'll find out why some young persons in the Upper West Regional Capital are using plastic bags as condoms.
These drugstores, people will have to be trained. They'll have to be trained seriously to maintain confidentiality. That no, you don't have to do leaking information. When people come to buy condoms or come to buy pills from you, you don't have to leak the information to anyone. It's confidential.
Hello again, many thanks for choosing us. Now, tonight, Ghanaian health officials are racing against time to prevent the spread of monkeypox disease after 5 cases of the rare infection has been confirmed in the country. Now, these were from 12 samples collected across the country. Though the first cluster of the latest cases of monkeypox were detected in the United Kingdom, the disease is fast spreading in Nigeria, Cameroon and other West African countries. Tonight, the disease has arrived in Ghana with cases recorded in the Western, Eastern and Greater Accra regions. Manuel Cranton of our health desk was at the news conference where this was announced and now reports.
5 cases. They are all well, nobody is critically ill, and that we continue our surveillance to ensure that all cases that are identified and isolated.
That is the Director General of the Ghana Health Service, Dr. Patrick Owusu, announcing Ghana's monkeypox cases recorded in the latest wave of the disease. West African neighbors like Nigeria and Cameroon are already recording large numbers.
In 3 regions, Eastern, Western and Greater Accra. This is where we've found the 5 cases. No deaths has occurred among the cases. One of the cases has been recorded in a Ghanaian who traveled to the United States from Ghana.
Monkeypox is a zoonotic disease caused by the monkeypox virus, transmitted from infected animals like rodents, monkeys, amongst others, or from infected humans. There are currently over 1,000 confirmed monkeypox cases in 29 countries. But how does it manifest?
It shows as fever, some swellings in the armpits and groin with the lymph nodes. We have headaches, muscle aches, and general body aches. That's how we went. And then, of course, then the rash and the blisters will appear.
There is no known cure for monkeypox. Even though there is a vaccine for monkeypox currently in limited supply, it is not yet available here in Ghana.
There's clearly no treatment for monkeypox. Fortunately, it's a mild to moderate case, and so especially the West African one is mild to moderate. So we only treat at the symptoms. If you have fever, we give you something to bring your temperature down. Body aches, we give you some painkillers to bring it down.
Dr. Patrick Owusu says the Ghana Health Service has stepped up surveillance to help keep a leash on the spread.
And then we have also sent sensitizations of clinicians, and then we've currently started contact tracing. So any case we have, any contact we have, any positive case, we do all their contacts to make sure that.
My colleague Manuel Cranton filed that report. Now, bushmeat sellers in Kumasi have rejected the suggestion that the consumption of bushmeat can spread the disease. This comes on the back of a warning by the Ghana Health Service cautioning against the consumption of bushmeat. My colleague Nanel Jima has been interacting with them, and he joins us via Zoom. And Nanel, you've been out there today interacting with these sellers of bushmeat. What is their basis for their rejection?
According to the sellers I spoke to today, they believe that due to the works that the veterinary service have been doing on their products that they sell. These products are spread by the Ghana Health Service. That their products are wholesome. And according to them, over the years, whenever there's a new disease, their products are targeted to the Ghana Health Service and other agencies. So they are saying that it is one of the deliberate attempts to deliberately affect their business negatively. That is, it's one of their attempts to kill their businesses. That's what some of them are telling us.
Okay, and they cite the situation with COVID, for instance. But how are consumers also reacting to this, the people who purchase from them?
So some of the people that I've been speaking to are not aware of the monkeypox in the country. According to them, they are yet to hear anything officially from the Ghana Health Service. So they wouldn't halt the eating of the meat. So at the time I went there, I saw some people in queue purchasing the meat. So it looks like the Ghana Health Service have some work to do in regards to this area.
But in Kumasi generally, what's been the reaction to the announcement today that was made by the Director General of the Ghana Health Service that we've recorded 5 cases already?
So from the conversations that I've been having with people, it looks like it's yet to catch up. A lot of people are not aware of the breaking news that some cases have been recorded in the country, probably due to the sensitization from the media. Lots of people in the city will get to know about the outbreak of this disease and take precautions to ensure that the spread of such a disease is checked.
Nana Ojima, thank you very much for bringing us those details from Kumasi on how bushmeat sellers are rejecting the suggestion that consumption of bushmeat could actually aid in the spread of the virus. But while health officials attempt to get a grip on the monkeypox disease, COVID-19 infections are also on the rise, with more cases of influenza virus also being reported at some hospitals. Dr. Patrick Owusu wants people to go back to wearing face masks in enclosed areas.
Vaccine wearing is not compulsory, but that has been our normal message. There are high-risk areas where if there's a patient who has it there, transmission is high. And these are enclosed spaces. These are places where there's very close contact, mass gathering, where people are then. So these are areas we continue to encourage that.
Schools, churches.
Schools, churches, inside an airplane. We encourage that people should wear their masks for that period that they are there, especially to help us assuage any further spikes. Workplaces where there's a gathering, people must wear their mask. In my office, if I'm there alone, I may not wear it, but as soon as I have visitors, I wear. And so you need to put in a system that creates some social distancing and also wearing a mask where you need to.
And we'll bring you some analysis on the back of this once we're able to work the phone lines out to speak to the various health experts. But let's stay on health. Like everything else, the price of sanitary pads has risen. Some women say it's now expensive to menstruate. However, some women in Choko have now chosen baby diapers over sanitary pads because they are cheaper and absorb more fluid. Ifo Aprikua Buafo has been tracking the NPP campaign promise to eliminate import taxes on sanitary pads and has come through with this report.
Ladies and gentlemen, we will eliminate import duties on sanitary pads to improve health conditions, particularly for girls. It's very important, but what we want to really do is to make sure we produce the sanitary pads in Ghana.
That was Vice President Dr. Mahamadou Bawumia on 22nd August 2020 making a firm promise that his party will eliminate import tariffs on sanitary pads if re-elected into power. The New Patriotic Party won the 2020 election, but the government is yet to fulfill its promise. Sanitary pads are subjected to a 20% import tax and a 12.5% value-added tax, making the product expensive for many women. Taxes aren't the only factor driving up the prices of sanitary pads. According to dealers, the high cost of fuel is also to blame.
Well, now le 5 cedis, 50 pesos, on le 7 cedis. She be at 9 cedis, on le 10 cedis. Ne, wa be agam no na mengo na meke petrol da na ngono. Wo no ya feto ni biye.
We say fix the country. Fix yourself. When it's that time of the month, Hagar, a resident of Choko, gets anxious because of menstrual cramps. But the rising price of sanitary pads is also giving her heart palpitations.
If we are entering new month, I become worried because the sanitary pad first, we used to buy it 5 cedis, but now some are selling it 8 cedis and some are selling it 10 cedis.
She is sometimes forced to use unhygienic materials, which can have serious reproductive health consequences.
The money that I was holding at that time is 5 cedis, and it's come by the sanitary pad, so I need to buy 0.
The rising cost of sanitary pads has forced many women to use baby diapers. Diapers are preferred over sanitary pads because they absorb more fluid and require fewer changes. Again, they are cheaper. Ayele explains how the baby diaper is used as a sanitary pad.
Inchio bia kabia no wafiat me fio spirit ka gbene nkagme papa se an ke ki 1 cd e wa mi an ke agba ke dan ma se ma cha ke ko shi pa de ne ke ga wodi e fe shi ete fe ni mi cha ke o bia ne papa se bon ke ya.
She's not the only one who menstruates in diapers. According to Jamila Mohammed, many women in Choko do the same. She does, however, add that when she does not have enough money for diapers, she uses toilet paper.
You use pampers ke tiro. Can you my pampers and use tiro? Tiro bega in your hair, come use over half my failure. My use it 2 times. Hello, if we me tick or by your useless 2 days, hello 3 days.
She gives a breakdown of why the rising cost of sanitary pads is economically squeezing many residents of Choko.
Baba feko ko bafutu me enyo 5 cedi e ko onye 6 cedi alo 7 cedi o ayo enyo 5 cedi no manage ole naka bia ne no po enyo 5 cedi bia ne ko be 4 cedi e o ba bula ga ko a he je epepa ni o ko a enu e bo ba gbo no epepa bia na 8 cedi no 8 cedi bia ne ko onyo 8 cedi besani o ya back no akota ko e alo ato ti roko no manage naka no cafe.
Activists have been calling on government to keep its promise of eliminating sanitary pads taxes. Social media has been flooded with posts explaining why the government should not tax women's periods. Esinam is one of the activists campaigning for the government to keep its promise of eliminating pad taxes. She tells stories about young girls who can't afford sanitary pads and have to resort to sex to pay for them.
We have seen in the news, we have heard stories, and they are real. It's not like someone is making them up, where girls are exchanging sexual activities just to be able to purchase sanitary pads. The prices it's just outrageous, you know, and it keeps increasing every day. It's becoming expensive to menstruate.
She makes a case for why the situation should be tackled with emergency.
In December, we bought a box of soft care pad, a box with 24 pieces at 95 cedis. You may want to do the division. Just last week, this same box was costing 165 cedis on the market. So you want to divide that by 24 and see the difference over the period. It's just outrageous, over 50% hike or increment.
Hagar, Jamila, and Ayele are pleading with government to pay attention to their cries.
His Excellency Nana
Ado Dankwa Ekufu. We beg of him, he should reduce the prices of things.
Sister me wa wompi woblo wo yemu ya hie ko wo ka abapo na ka wie pomi sumo ni wo ito makala ka bia ne beni ni bi jale wa iwo ekwo na che no fia na ka wote me ko wo benu sumo kwakwa ko ni wo chu.
This is a reminder to the government to listen to the cries of women and act swiftly. Ifwa Aprikwa Boafo's report, Joy News.
Hungry man say fix the country, Belefu say fix yourself.
Prime with me and Asminu. Let's return to our earlier story on the cases of monkeypox that has been detected in Ghana. 5 of them so far. Let's go on to the phone lines now and speak to Professor William Ampofo, who is head of virology at the Noguchi Memorial Institute. I'm grateful, sir, for your time here on the bulletin. So let's first start with some education. In terms of how this disease spreads, I am under the impression it works as Ebola spreads. Is that right? Is that a right assertion to make?
I'm sorry, let's have a correction. I am retired and I'm working on in the University of Ghana on post-retirement contract. So the current head of virology is Dr. Kofi Odum.
Very well.
So let's have the affiliation correctly.
Very well. Thank you so much for that correction.
Yes, so what was the question again?
So the question in terms of how this spreads, does it work like Ebola, like we've seen in the past?
Well, it's spread by coming into contact with the fluid from, it's a rash that is a sign of infection. So when you come into contact with fluid from the rash of a person, you probably have also broken skin. Your skin is not intact, then you could get infected. There has been infection of healthcare workers from contaminated bedding of patients in health facilities. So that's the mode of spread through contact with contaminated fluid from an infected person.
How vicious is this as compared to COVID or even Ebola, the death rate, for instance?
Totally different from COVID. COVID is a respiratory infection, so it's airborne transmission, through droplets in air on surfaces. But monkeypox is transmitted by contact with infected material, so on surfaces, and not airborne transmission. So completely different, please.
How fatal can it be?
The actual cases have been mild, So monkeypox is associated with mild illness, and then the case fatality rate is actually very, very low. These rashes, like pustules that appear on the skin, that makes it a very, the symptoms are quite graphic, but mortality rate has actually been very low. I think it's recently in Nigeria. There was an ongoing in Nigeria for the past 2 years, and it's I think recently that there's been description of a couple of people who have died from this infection. Usually it's mild infection.
What should we look out for in terms of the symptoms and how to detect this?
The Ghana Health Service has published a correct set of case definition for clinicians, and this rash that usually appears, and it's distinguishable from chickenpox. We know that smallpox has been eradicated, so having a rash that doesn't go away, spreads from the face and then towards the extremities. So the clinicians have a good idea of what to look out for monkeypox.
What can we do to contain the spread of this disease? Already we know that one of the 5 was actually imported, one of them from the US. And so how do we contain this?
So actually, monkeypox is endemic in West Africa. So that's why I referred you to the ongoing outbreak in Nigeria, which the Nigeria Center for Disease Control described last year. And we know that monkeypox is endemic in Africa. So we actually have records of the first cases being exported to the other parts of the world. So containment and prevention of spread is actually setting up the diagnostic system, and we do have that at Noguchi, and some of the other centers are also setting up is molecular diagnosis, looking for the presence of the virus in materials and And being able to pick it up with the molecular method is the standard approach for emerging, re-emerging viruses.
Like COVID, we saw, asymptomatic cases. Can we have similar situations with monkeypox?
Yeah, with any viral infection or with any, where the person is infected before the rash appears, there could be, asymptomatic cases. But I think so far the data that we are getting from the Western countries where there have been the spread of rash of cases spread in the past a few months is being associated with homosexual activity. So, as I said, if there's a break in the skin, then this could lead to transmission of fluids from an infected person to another person. Safe sex would limit transmission from what we know so far of the recent cases. And then, of course, infection prevention, the standard thing, but not like COVID, which is a respiratory pathogen airborne. It's a standard thing, hand washing and good personal hygiene.
The Director General of the Ghana Health Service indicated that there's vaccine for this, but he doesn't think that it is time or the situation warrants, procurement of the vaccines. What do you think? What is your position on this?
Yes, there has been the discussion that there's been modeling that showed that with the eradication of smallpox and therefore the discontinuation of the smallpox vaccine, the world could see another pox virus emerge, and some are thinking that it is associated with, in some cases where smallpox vaccine could be used to have some significant immunity. But as the DG rightly said, smallpox has been eradicated, and it's not time to start thinking that the smallpox vaccine should be activated and deployed. Let's wait and see. I mean, as I said, the cases are endemic in West Africa. Our neighbor Nigeria has had some significant cases and is monitoring the situation. Knowing that a vaccine is an effective tool, like we're using for COVID and for Ebola, we could set up some, look at where, the epidemiology of the virus, look at where people are susceptible, and then set up some kind of program where we could offer protection to those people who are most at risk.
Very well. Professor William Ampof, I'm grateful for your time. That's a virologist at the University of Ghana. He was formerly the head of virology for the Noguchi Memorial Institute for Medical Research. The Director General, the Director of Public Health at the Ghana Health Service, Dr. Franklin Nesidi-Bequin, has been given more detail on the new cases. He spoke on Joy FM on Newsnight.
It's actually endemic in Nigeria and part of Central Africa, including like Cameroon. So if you pick up Cameroon or Nigeria, they've been having cases over the past five years. The issue was the occurrence of monkeypox in non-endemic countries, particularly in Europe and the US. So that brought about the scare. So for Ghana, what we did was that we immediately sent an alert to all our health facilities, and then we also sent common messages to the general population to sensitize them about how you can report a case if you think you have one. But the first case that we had was actually a case that was confirmed in the US. So it's a lady who came for holidays and went back to the US and then got a rash and then was confirmed as monkeypox. So we were informed, and then we went to the husband and then we took the sample. So that one came as a positive case.
Was she in Accra? Just to clarify, did she live in the Greater Accra region? Where exactly was she residing?
Oh, I don't think we want to communicate that kind of information. But the issue is that the person is in Accra. So our team went to him. Apparently he had gotten some rashes, but was not sure what it was. But when the wife was confirmed, I mean, that was the time that we had gone to him. So we took a sample and it came as positive. The other ones were not sure what was. Like was a baby of 2 years, had some rash, the mother sent to the hospital, and they took their sample, it came as positive. But I think what is good is, one, is your system able to suspect? So do you have clinicians who can suspect. Basically, you do that when you use the case definition.
Well, before you get into that, Dr. Asiedubekwe, I would want to find out, at least you've talked about this woman and the husband. These cases were recorded in them. Other 3 cases that were recorded, did they have any relationship whatsoever with these 2 persons?
No.
Okay.
No, there's no linkage between these cases. Apparently, so far, we are struggling to establish the source of the infection. It's zoonotic. So it's like it can start from an animal to man. But so far, we are struggling to see how the cases got infected. I mean, sometimes it's faster to get it. So as I said, the other cases, they are also children who go to school, get on rush. And then because the clinicians have high levels of suspicion, they put a sample and then the lab confirms them.
Let's do some other stories now. The executive director of Necessary Aid Alliance, Mulumba Songsori, is urging parents to engage their wards in sexual-related discussions. This comes after research findings by his firm show that over 29% of male adolescents are replacing condoms with rubbers for sexual activities in the Upper West Regional Capital. Wow.
Having on training exercises for various health personnel to ensure confidentiality and also issues on privacy in these various health facilities. Most of them are complaining that there's no privacy. You go to have conversations on the issues that affect you as a young person, but the structures available does not permit that privacy component. So they fear going to these facilities. Also, these drugstores, people will have to be trained. They will have to be trained seriously to maintain confidentiality. That no, you don't have to do leaking information. When people come to buy condoms or come to buy pills from you, you don't have to leak the information to anyone. It's confidential. And also, there have to be an intense education on parents, the religious, but to start discussing issues of sexual and reproductive health. You shouldn't relax with things like this. The various Center for National Cultures, will have to engage parents, more frequently on the fact that discussing issues on sexual and reproductive health with your ward, it's something that is a move in the right direction. You shouldn't shy because of cultural barriers and then religious barriers to say no, discussing these issues with our ward, it's wrong. They should amplify, they should have conversations with their various wards so that it can break the gap on knowledge sourced from friends. Friends absolutely know nothing, they're just like their various peers. What do they know as compared to their parents? So we have to break that research gap so that the parents will dominate. The health institutions should dominate the chat on sources of knowledge.
Let's find out more. Joining us via Zoom is the lead researcher and the executive director of Necessary Aid Alliance, Mulumba Songsori, and also the Upper West Health Director, Dr. Damien Puyungri. Thank you very much, gentlemen, for your time here on Joy News Prime. Let me start with you, Mr. Songsori. First of all, what kind of rubber are we talking about? Is it the regular black polythene bag? What kind of rubber? Just give us, the details.
Yeah, thank you so very much for this opportunity. When we talk about rubber, there are several rubbers which people use. It could be black polythenes, but most often they prefer to use the transparent ones. The ones they usually use for selling the cocoa, which is more transparent. And it's somewhat similar like a condom. So preferably, these are what some of them have been using.
How widespread is it? I mean, your research said 29, but in terms of the nominal figures, can you share with us, and in which particular areas of the capital?
So this research was conducted in one municipal, Sisala West, then Sisala East. We also did some Wa West was another area that was sampled for data collection. So you get to understand what is the trajectory we are talking about here. 61.7% of respondents are sexually active. And when someone is sexually active, definitely, if there are barriers, because if you have to check, if I'm to give you an overview of this research, we set out to go investigate 4 key objectives. First of all, to access knowledge, to also investigate the sources of knowledge, to measure the level of satisfaction on issues on sexual and reproductive health, and also critical is to access the barriers in accessing sexual and reproductive health information and services. So when you come down to the barriers, taking the fact that 61.7% of them are sexually active, it means they'll have to adapt adaptive measures to engage in what? Sexual intercourse. So what are some of the barriers? To get a clear understanding of this situation, you get to understand that most of the rural communities, because of the fact that it's rural in nature, like I said earlier on, the person selling at the drugstore is familiar with almost everyone in the community. So you go there to buy, definitely the information will be leaked to your parents. That, oh, this person came to buy condom. This person came to buy.
So in other words, it's a closely knit community. And so if my producer David walks into a pharmacy or wherever to get his condom, he definitely must meet somebody he knows. And that information is likely to also spread that he's been in there to buy condom. Is that the situation?
Yes, but to get a clear understanding, one municipal was investigated. And you could see that issues, a large place like one municipal, people don't do that because there are several drugstores which someone can easily go and buy, and you might not be known because why it's relatively a larger place. Yeah. So a place like Accra, which is cosmopolitan, people will not have absolutely no fear to go buy condoms because you seldom know anyone there because it's a very large area. But if you go to the rural communities, this is when this is persistent.
Was cost ever a problem or an issue that came up in the course of the research? The cost of the condoms?
Please come again.
Was cost ever an issue in your research? Did it come up?
Yeah, cost didn't really come out as an issue. Okay. When you want to engage in an activity, definitely you should have the appropriate financing to buy it. So cost was not so much of an issue. No one talked about cost because it's something you want to do and you should be financially prepared for it.
Very well. So mainly these are cultural barriers and in terms of the structures. I'm very grateful for your time, Mr. Song. Sorry, but let's get a quick word from the Regional Health Director, Damien Punyungri. Thank you very much, sir. This must be of concern to your directorate. Is this something you are aware of or is this new for you?
So good evening, and thank you for having me. Well, I'm hearing about this issue of rubber, people using rubber as condom for the first time. I tried to find out exactly, just as your presenter was trying to find out. It's been difficult, but the local name for condom itself is rubber. Okay. So if the interview is in the local language, certainly people are going to, you ask, do you use rubber? That's the question they commonly ask. But it's quite, if the people are really using rubber as condom, it's a source of worry. It's a cause of worry to us as health workers because we've done a lot of education, public sensitization. And then at the community level, fine. Where access is a problem, we have adolescent health corners dotted in chief zones where young people can go for education, sexual education, and also can have access to contraceptives, including condoms. So it's surprising to us, and it's a concern that people will continue to use rubber because scientifically we know that condoms are tested. They are tested to be effective, and then they are approved by our Food and Drugs Authority to be safe for use, to do the work that they're supposed to do.
But you talk about the community centers and the other facilities that are available to make these products accessible to the young people. But the research also highlights the lack of privacy at some of these centers. Is it something that you identify with?
Yes, we do know that even health workers have their own biases when it comes to sexuality. But what we have been doing is organizing health education. We conduct training for our health staff on adolescent-friendly services and adolescent sexual reproductive health, where they are taken through these things, and then value clarification to ensure that their values align with the values of the Ghana Health Service when it comes to adolescent sexual behavior. That is not to say they should just go and be promoting unprotected sex, but shouldn't be judgmental when young people approach them for education and for their services.
Very well. I'm grateful for your time. That's Dr. Damien Puyigwe, who is the Regional Health Director for the Upper West Region. You're watching Joy News Prime with me, Ernest Mino. Still to come, we'll tell you about the rising cost of inflation and if there's ever a solution to this. Thanks for staying with us here on Joy News Prime. Increase in transport fares and surging food prices have pushed the rate of inflation for May 2022 to 27.6% from the 23.6% recorded in April 2022. According to the government statistician, Professor Kobna Enim, the rate of inflation for transport, household equipment, maintenance, housing, water, gas, electricity, food and non-alcoholic beverages are all higher than the national average. Kofi Eje of our research desk joins me in the studio. He has the data as released today. Kofi, run us through the figures.
Right, so Ernest, let me quickly go through the figures. So last month we were talking about 23.6% and we're saying that was too high, but this month we are looking at 27.6%. And this same period last year, inflation was a single digit and was around 7.5%, and this year we are having 27.6%. So you can see the upward trajectory in terms of the inflation, figures. Now, if you compare Ghana to other African countries, so to Ivory Coast, South Africa, Kenya, Togo, and other African countries, you can see that Ghana's inflation is relatively higher than all the countries.
Way up there.
Absolutely. All the countries that we are talking about, here. And so let me take you to the market, and you can see that oils and fats has an inflation rate which is, just like you said, it's above the national average, 52%. Water, 42.4%. Cereals and products, 37.2%, and the rest follow. And so if you should also look at other products like bread, I love bread, it's around 41.3%. Bars, fares, and trotro, if you take trotro, you should know that prices have gone up 39.9%. Cooked rice, we all eat cooked rice. It's also
yes, my rice is getting expensive every day.
Yeah, and that's also around 32%. We look at herring, smoked herrings, that's 31%. Smoked herring, and that's amani, right?
Yes.
That's also 31.2%, and other products. But what effect does this have on your purchasing power? So this simply means that generally, if you were purchasing something which is 10 cedis last year, now you need, 12 cedis, 76 pesos to buy that same thing. If it is in the arena of food, you need 13 cedis. If it is transport, you need close to 14 cedis. If you are buying something that is 100 cedis last year, generally now you need 127 cedis, 60 pesos to buy that same good. And if it is in the arena of food, now you need 130 cedis. And if it's transport, you need 130, 90. This is the at least situation that we are talking about here. And lastly, let me take you through this. We've been talking about, fuel prices going up. So diesel has increased by 81.1%. Petrol here has also increased by 62%. And all these figures, most of which are above the national average of 27%.
No wonder transport is leading and driving the inflation rate. Kofi, thank you very much for bringing those figures to us and helping us understand. But Dr. Patrick Owusu is an economist at the University of Ghana Business School, and he joins us live. Doc, this is the second time we are seeing that imported inflation, for instance, is overtaking local inflation. What is really accounting for this?
Good evening and good evening to viewers. So we have seen in recent times the inflation around the world has gone up. So we have US and UK seeing record high inflations. So one reason why that would translate to imported inflation, imported items going up is that even if the things we are buying from the US, for instance, if the dollar price has gone up, even if the exchange rate is the same, when you convert it to CD, it's a higher price. So there's that side. But the other side is also that if you look at the currency hasn't been stable. So when the CD loses value, then anything that you are bringing from the US, even if the US price is the same, you see that the CD price will be higher. So mainly the fact that inflation in our trading partners is going up, and also the fact that the currency has been unstable. Those are major explanations for why imported inflation is picking up.
When the rate hit 19, when inflation hit 19, we saw the Bank of Ghana adjusting upward the policy rate. Do you foresee a similar measure following this figure that has been recorded for May? And that definitely has implications for credit, for instance. Well,
I don't think that we should see a rate increase anytime soon. Okay. So there are a couple of things. One is that when you increase the policy rate, its effect is not felt immediately. So even the 200 basis points increase we saw in March, usually it will take upward of maybe 2 quarters to 3 quarters.
Okay.
Before we see its full effect, go through the economy. So the first round of increment, we didn't see the full effect before at the last meeting, there was another increment. So I wouldn't expect that the Bank of Ghana will be in a hurry to raise the rates again soon. But the other thing is, I think the governor, in the recent interview that he gave to Bloomberg, admitted as much that the inflation, the current bout of inflation is primarily driven by supply side factors. So there's so much that raising the policy rate can do to fight that kind of inflation. So at some point, we have to deal with the supply side issue.
But Doc, just finally, before you take leave of us, are we simply helpless?
So I think from where I said to raise the rate again.
Are we helpless? Yes, are we simply helpless when it comes to reversing the trend? Because we've seen a consistent hike in inflation prices, and it doesn't seem to be getting any better. Are we just helpless?
I wouldn't say we are helpless, but I would say that the main solution will be medium to long term. We are not going to get a quick solution to this. If the inflation was primarily monetary, then maybe the monetary policy rate will deal with it quicker. But the supply side things, it takes a while. So if you see that food inflation is really been the biggest driver between food and non-food. The food inflation has been the major driver of the inflation we've seen recently. And so part of that is that maybe the food items that we import have gone up a little bit, but a big part of that is also local inflation on food. Local food items have gone up. Usually that means that you need at least a planting season to address that problem. So some of the problems we are seeing with food inflation are things that, problems we had with the planting season, and also problems with our food distribution channels and networks that have piled up. So those ones are things that we don't solve in a couple of months. It take a while for those to be addressed. So we are not really helpless, except that we don't have a quick fix. It's going to take a while.
I'm grateful for your time. That's Dr. Patrick Owusu. He's an economist at the University of Ghana Business School. You're watching Joy News Prime. We're taking a break. When we return, we have the latest in showbiz.